WHO has now held its Border Health webinar on the Hondius cluster, and the Director General is on record this week calling global risk low, with a case count that still hasn't moved. This is Hantavirus Watch. Sarah here, Brian's across the desk. The logistics crunch is winding down, but the treatment gap story is opening up.
5 U.S. passengers walked out of the Nebraska facility. It's in print today. So let's sort out what we actually got this week versus what we're still chasing.
Start with the webinar. It ran yesterday, June 4, at 1 o'clock CEST, and it was framed entirely around IHR points of entry.
Right, the session happened. Did any country actually get a complete passenger manifest through the IHR channels? Or is unprecedented test the whole answer?
WHO is treating the test as the point, using this cluster to stress the border health system. What I haven't seen come out of it is any specific finding on national focal point performance.
So the headline's the deliverable. The system gets graded and nobody publishes the grade.
The institutional record on this one will be interesting to read in 6 months. Right now, it's mid-sentence.
Okay, the Korea Times piece. The AP says this outbreak is renewing the push for hantavirus treatments and vaccines. That's the new piece I've been waiting on.
And it matters because it's Andes virus, the one strain with documented human-to-human transmission. That biology is exactly why researchers are calling out the pipeline gap now.
Here's my problem. Favipiravir in France, Spain, the Netherlands on compassionate use. 5 Americans just left a federal facility. If one of them spikes a fever next week, what's their experimental pathway?
There isn't an approved one. No licensed antiviral, no vaccine. Favipiravir is still clinical trial or compassionate use only. That's the distinction the AP is finally putting in print.
And the CDC situation page, does it say a word about access, or is it still monitor for symptoms?
It's a monitoring page. Access isn't its lane. That's exactly the gap the researchers are pointing at.
Now look at Belgium. Antwerp University Hospital assesses their passengers. Then they're sent home with contact limits for a number of weeks. That's an actual published pathway. The 5 Americans got released under what clinical criterion? Belgium published a standard. We still haven't seen ours.
2 different release models, and only one of them is easy to read from the outside. That's a fair thing to put on the record.
And the home isolation move is the part nobody's pricing in. If Andes spreads person to person, a household contact in Antwerp is a border health question, not just a clinical one.
Which takes us right back to the webinar's premise. Singapore's monitoring window closes tomorrow, June 6th. No new case, no positive test. The dispersal story is nearly closed.
Fine, the logistics are basically closed. Whether anyone can treat the next symptomatic person is still wide open. That's the loop I want shut next.
Here's World Health Organization.
As of 21 May 2026, a total of 13 cases, including 3 deaths, have been reported. Public health response efforts continue in all countries involved, including information sharing for international contact tracing purposes through the National IHR Focal Point, NFP, network. WHO has assessed the risk posed by this event to the global population as low and continues to monitor the epidemiological situation and update the risk assessment as needed.
The session we flagged actually ran, June 4, 1300 to 1400 CEST. WHO is framing this cluster as a quintessential border health event, a stress test of the IHR points of entry provisions, Part 5 and Part 6.
Okay, it ran. So did anybody come out of it saying a country actually got a complete passenger manifest through the NFP network? That's the answer I've been chasing since Tuesday.
The notice itself doesn't name that finding. It does say this plainly. 13 cases, 3 deaths as of 21 May, and that count hasn't moved. The Director General's assessment of global population risk stays low.
So the headline answer to unprecedented test of the global border system is, the test is still ongoing. Belgium gave us a hospital and a time frame for its passengers. WHO's webinar gives me a part number.
The Arkansas Democrat-Gazette, Arkansas's best news source, writes,
Omaha, Nebraska. 5 of the 18 American cruise ship passengers who have been staying at a national quarantine facility in Nebraska after being exposed to hantavirus are going home, U.S. health officials said Monday. The 5 people will complete their monitoring at home after remaining symptom-free and meeting criteria for monitoring outside the quarantine unit at the University of Nebraska Medical Center.
The Andes virus cluster from the Hondius. 5 of the 18 Americans at the Nebraska quarantine facility are going home. They stayed symptom-free and met the criteria to finish monitoring outside the unit at UNMC.
Met the criteria. Okay. Which criteria? The Belgians going home this week get Antwerp University Hospital doing the assessment, then home isolation for a number of weeks. The 5 out of Nebraska left with no published standard at all.
And the floor hasn't moved. 13 confirmed or probable cases linked to the ship. 3 deaths per WHO. 0 Andes cases confirmed in the U.S. The count today is the count from last week.
3 weeks in Omaha, not a symptom among them. And the incubation window has run as long as 42 days in past outbreaks. So the other 13 aren't out because the clock isn't done, not because anything went wrong.
BERNAMA writes.
Moscow, May 6. BERNAMA Sputnik, RIA Novosti. The public health risk of hantavirus, cases of which were identified among passengers on a liner in the Atlantic, is considered low at the current stage, World Health Organization, WHO, Director General Tedros Adhanom Ghebreyesus said on Wednesday. At this stage, the overall public health risk remains low, Ghebreyesus wrote on X, reported Sputnik, RIA Novosti.
The Director General is on record this week via X. Tedros put the overall public health risk at low. Andes strain, 8 confirmed, 3 deaths, with diagnostic work run through institutes in South Africa and Switzerland.
8 confirmed, 3 dead. That's a brutal case fatality rate. So risk remains low, and this is deadly for the people who get it, can both be true at once.
Both true, and they're not in tension. Low population level spread risk, high individual severity, that's the Andes profile. And it's why the vaccine and treatment push is the live story now, not dispersal.
Right, and Tedros repeating the low-risk line on X is good for the global headline. It does nothing for the 5 U.S. passengers who just walked out of a federal facility with no named treatment pathway behind them.
This one's from Belgian news agency.
The 2 Belgian passengers on board the cruise ship where a hantavirus outbreak has been confirmed will undergo a medical assessment at Antwerp University Hospital upon their return to Belgium. They will then be permitted to go home, but will be required to limit contact with others for a number of weeks. Both individuals are currently showing no symptoms, according to the FPS Public Health. The risk of them infecting others is described as very minimal.
2 Belgian passengers assessed at Antwerp University Hospital, then home with limited contact for a number of weeks. That's a specific pathway, where they go first and how long they limit contact. Compare that to the 5 U.S. passengers who just walked out of a federal facility. No named clinical criterion, no published standard. Belgium told us the institution and the timeline. We're still guessing.
And FPS Public Health is precise here. Both asymptomatic, infection risk to others called very minimal. The home monitoring isn't because they're spreaders, it's because the incubation window runs up to 6 weeks. There's also a 3rd Belgian, not a case, a name on the contact tracing list. That's the Andes caveat in practice. Human-to-human spread can't be ruled out, so contacts of contacts get tracked. 8 suspected, 5 lab confirmed. That count hasn't moved. The Korea Times writes,
Santiago, Chile. When a rare but deadly rodent-borne virus struck passengers on a cruise ship and seemed to be spreading, there were no treatments for those who fell ill and no vaccines to protect others. That was the case even though it wasn't a novel germ that the world had never seen before, like the virus that caused the coronavirus pandemic.
The strain here is Andes virus, and the AP out of Santiago names the gap plainly. No approved treatment, no vaccine. Favipiravir is still compassionate use or trial only. That hasn't changed. What's new is that researchers in Chile, Argentina, and the US are now saying the underinvestment part out loud. And they tie it directly to the fact that Andes doesn't spread easily person to person. The rarity is why the pipeline is thin.
Right, and that's the catch, isn't it? It's rare, so nobody funds it. So when 5 Americans walk out of a federal facility, there's still no named experimental pathway if one of them spikes a fever tomorrow. Favipiravir's sitting in France, Spain, and the Netherlands. The drug exists. The AP says people are finally pushing for access. Last edition, it was shipments. Now they're asking why these drugs are still lagging.
And there's one new detail buried in it. Researchers published Wednesday that an autoimmune drug may help hantavirus patients. Early hint, not a therapy. But it's the first concrete treatment signal this whole cluster has produced.
If you follow Hantavirus Watch for clear outbreak updates, you might also like Ebola Watch, a daily DRC and Uganda Ebola outbreak briefing with case counts, border tracing, WHO vaccine news, and traveler guidance. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. So if one caught your attention, you can go straight to the source and read more. That's Hantavirus Watch for today. This is a Lantern podcast.